Welcome back. This is the Thom Hartman program, filling in for Tom. I'm Carl Frisch all afternoon. It's about 20 after. You can find more about me at carlfrisch.com. Follow me on Twitter. Push me over that 10,000 mark already at Carl Frisch, KarlFrisch. Joining me now is the chairman of the American Heart Association, Bill Roach. Bill, thanks for joining me.
Hello, Carl.
How are you?
I'm well, thank you.
So you've been watching today's news. What do you make of it?
Well, one never knows how this is going to unfold. It's for us a welcome opportunity to resolve some of the issues with this act. It's an important act to us, and I think it's an important act for the nation's health. So we're pleased to see this moving forward.
Well, you know, I had Doug Kendall from the Constitutional Accountability Center on earlier in the program, and he said as he sat in and watched the arguments today, he said that it was his perception that Justices Stevens and Kennedy seemed to be pointing in a direction of voting to uphold the constitutionality of the mandate. If for no other reason than the mandate was so closely tailored to the problem it was trying to address. How important do you think it is to uphold that mandate?
We think it's very important. The goal that we have as an organization is by 2020 to improve the cardiovascular health of all Americans by 20% and to reduce deaths from cardiovascular diseases and stroke by 20%. To get there, that's a very ambitious goal. To get there, we need for people to have guaranteed affordable health care. And that mandate we see as an important piece of making healthcare available to cardiovascular patients and stroke patients who often are facing denial of insurance coverage or reduction of insurance coverage because of their pre-existing condition or current health. Without the mandate, the principle of the insurance pool, as it seems to us, fails.
Right.
And I think the states that have enacted prohibitions against denial for precondition and chronic disease without a mandate have shown that it won't work. The insurance becomes too expensive, and in a couple of states we've seen repeals of those patient protections. So to us it's a critical piece and an important piece to achieve that principle of coverage.
Well, you know, from a cultural perspective, it occurs to me that when a child grows up in a family that has insurance and uses its insurance for checkups and physicals, and when somebody gets sick, they go and see a doctor to make sure everything's okay. When somebody grows up in a household that has insurance from the time they're born and they're not worried about losing that insurance, you tend to end up, you perhaps in a generation or two, end up with a healthier country simply because people have always had access, at least in their memory, have always had access to decent care and have always felt comfortable going to a doctor.
Exactly. No, I think that's true, and part of that cultural habit, if you will, is understanding the importance of prevention.
Right.
And for us, the prevention provisions of the Act are critical because they will address the rapidly escalating cost of cardiovascular disease and stroke in our country. I mean, we're looking now at $286 billion a year in cost, and by 2030, considering that over 40% of Americans are likely to have cardiovascular disease of one type or another, we're looking at $1 trillion annually in direct costs and another $284 billion in lost productivity. So
it's not just the right thing to do; it's also good economic sense.
Absolutely. I mean, I say to people, we have got to control these diseases because as a society we cannot afford the cost, and we cannot burden our economy in a global competitive world to carry that kind of cost. So this act stresses prevention, and is already making available to Americans preventive measures that will identify low cholesterol, will bring nutrition therapy to people, and get folks to live tobacco-free that will reduce these diseases over time.
Well, taking us out of the politics of the day, just for anybody listening at home who hasn't heard the message of the American Heart Association before, what are the best steps that one can take to live their life in a way that avoids heart disease?
Thanks for asking that question. There is a very simple step people can take. If people go to the American Heart Association website,
heart.org,
and look at the button for Life Simple 7, they will find the 7 measures that will enable them to achieve ideal cardiovascular health. And if they can achieve those measures, things like reducing cholesterol, eating healthy, tobacco-free life, getting exercise, there are metrics there on the website that will allow them to measure where they are with these 7 critical factors. If they can achieve ideal health with those 7 factors by the age of 50, the chances of their having any cardiovascular disease or stroke the rest of their lives is less than 10%.
Bill Roach, the chairman of the American Heart Association, thanks for joining me today.
Carl, thanks for having us.
This is the Thom Hartman Program. Go and follow the American Heart Association on Twitter, American_Heart. We'll be back in just a bit, and we'll be talking to Laura Ruderman, a former state rep from Washington who's running for Congress, and she's got a great story to tell.
You're listening to the Thom Hartman Program.